Welcome to another episode of Plastic Surgery Uncensored. As always, I'm your host, Dr. Rady Rahban, and today's show is actually a timely show. It's a timely show because we're entering summer, and this topic is really important for summer. More importantly, May is Skin Cancer Month, and last but not least, there's a ton of celebrities who are dealing with and battling skin cancer, so we felt this was apropos. We've spoken about skin cancers in the past. I've had one where I had a skin cancer dermatologist, Mohs surgeon specialist. We've had other ones, but I thought it's been a while, and since we have a lot of new listeners, I thought I'd rehash some of the skin cancer basics for all you to listen as we enter into the summer months. So let's just chat. Who's getting skin cancer? I mean, isn't skin cancer something you get in, like, I don't know, the desert, and like you have to be 100 years old? No. Hugh Jackman's not 100 years old. Hugh Jackman's actually 52 years old, and this is apparently his second skin cancer. That's right, second skin cancer, and this most recent one was on his nose. That's some seriously expensive real estate, especially if you're Hugh Jackman. So what about Tom Arnold? Is Tom Arnold 100 years old? Nope. Tom Arnold is 62 years old, and Tom Arnold just had skin cancer removed off of his back. That's right. So we have a nose and now we have a back. There's an Andy Cohen, yet another 52-year-old who also doesn't live in the middle of the Mojave. And he got skin cancer where? Of the lower lip. And this is not your garden variety skin cancer, but rather melanoma. And melanoma is definitely no joke. We'll chat about that. How about Caitlyn Jenner? She's 71, now slowly approaching that age that we're talking about. And she had a skin cancer on her nose, and apparently have had skin cancer multiple times before. And last but not least is Diane Keaton, yet another individual who has had multiple. She wrote 20 skin cancers from the age of 21, and now she is a 75-year-old woman. So let us chat. This is not something that only happens to some random-ass old person in the middle of the desert. This is something that happens to a lot of people, as you can see, in various locations on their body, in various locations in the world. So let's chat about skin cancer in general. What is it? It is a cancer of the largest organ of your body, your skin. And there are different cells that make up your skin, and therefore skin cancer is made up of different cells or different kinds. There are three basic main categories of skin cancer. One of them is called basal cell carcinoma, basal cell skin cancer. A second one is called squamous cell cancer or squamous cell carcinoma. And the last is the dreaded melanoma. Now, there are other skin cancers, but in comparison, they are a significant minority of these skin cancers. Now, squamous cell and basal cell tend to be, I don't want to use the word less aggressive, but no, actually I can use the word less aggressive. They're significantly less aggressive than melanoma in that generally by the time you notice them and you identify them and you treat them, they usually haven't spread all over the body, but rather remain local being right in the area that you found them. Melanoma, on the other hand, tends to be very aggressive and tends to spread to other parts of the body, called metastasis or metastasizes to other parts of the body, and you can absolutely die of melanoma, and that is a relatively small melanoma if you don't identify it. So what occurs is that the cells on your skin, they start to become abnormal and then slowly kind of grow into a tumor and then start to invade the area near them. Basal cell and squamous cell, you usually identify them as like, most people say it's this like a scab or an area that just won't go away. It keeps bleeding and crusting and getting itchy, and maybe it's getting a little bigger. Those are often the way they present. They don't present like you think, which is, oh, this mole looks really weird. Those are melanomas that tend to do that. So squamous cell, basal cell, like some kind of skin lesion that tends to just be, if you will, very annoying and repetitive and not going away. Melanoma, on the other hand, often is as the name is, melanin, which is pigment, which is often, not always, located with some type of mole or dark lesion that tends to kind of get a little different. And what are those differences? They start getting larger. It may have irregular borders. It tends to get multicolored, and it may bleed. And those are some of the common symptoms, or common rather signs, that something is getting a little suspicious. Nevertheless, we have to figure out how do I get it? How do I diagnose it? How do I treat it? And how the hell can I prevent it? So let's talk about how we get it. The overwhelming majority of skin cancers are caused by sun exposure. That's right, sun exposure. Now, there are some skin cancers that are genetically driven. There's some melanomas that are genetically driven. But by and large, the overwhelming majority of skin cancers come from thermal or heat energy, or some kind of energy that causes the cells of the skin to go off course and derail and start getting abnormal, right? And you're not going to go to the beach generally and have a tan and then all of a sudden get skin cancer. That's just not how it works. And if you look at these celebrities, most of them are mentioning that this isn't their very first. Or they've been just very unlucky and they've gotten struck by lightning multiple times. Like, can you get, I don't know, a cancer of the right ovary and then just by sheer dumb luck, you get it of the left? No, it doesn't generally work that way. But skin cancers are absolutely cumulative. What does cumulative means? It actually turns out, and the studies have shown, that the people who get skin cancers generally in their 40s, 50s, 60s, and 70s, as is the case with all these celebrities, probably caused the damage when they were young adults, teens, early in their years. In other words, it's the sum total of all the sun injury that you had when you were a kid. Listen carefully for all the parents out there taking their kids to the pool and the beach. You don't just get a suntan and then all of a sudden get skin cancer. No, it's an accumulation of summers and summers and summers whereby which you got burnt and you peeled and you got red like a lobster and you never paid attention. And that repetitive damage adds up. It's accumulative. And then sometime later in your life, you start to develop these skin cancers. Once you start getting them, you more often than not get them over and over again. Why? Because the whole skin was subject to the same amount of radiation from the sun. In other words, if you get it on your nose, right at the tip of your nose, there's a good chance that a centimeter over on your nostril is also been fried, and that also is going to present, and also your cheek, etc. So it is quite common, as in you can see with Diane Keaton. She's had it all her life. Another common theme here is that often these patients are very light-skinned. Not always, but often. Most of these people are fairly white, non-pigmented. It's not as common to get a skin cancer if you're African American or if you are Thai with dark skin. The melanocytes, the melanin-containing cells, tend to protect you, whereas fair-skinned individuals are greatest at risk, and they tend to be the ones who get burnt. Other things that give it to you, the worst thing on earth you can do, worst, is tanning boots. Tanning boots are by far the worst thing you can do. They're like sun exposure on steroids. In other words, like you go to the beach, you go to the pool, and if you get in a tanning booth, it's like months of exposure in small sessions. So I still can't get over tanning boots. The idea of sitting in a human-sized microwave still baffles me. I get it. At the beginning, when they came out, people just, didn't know any better. And there is no question that people look better tan and sexy than like yogurt. But we know better now. We know smoking causes lung cancer. Like, we know this shit. So you really want to avoid Um, tanning booths. Okay, so how do we diagnose it? And the key to diagnosis is paying attention. You got to identify it. It's called a skin check. Most patients identify their skin cancer either by their own routine checks, like, God, that's so odd. I keep getting this area above my eyebrow that keeps scabbing and then bleeding. It feels like a zit, but it's not a zit. Maybe it's, I don't know. And it just keeps going on. And then eventually you go to a dermatologist and then they do a what? A biopsy. They remove some of it, send it to pathology and look under a microscope. Alternatively, and what needs to happen for people that are prone to skin cancer is they have to go get routine skin checks. You got to go into your doctor, dermatologist, family practitioner, etc. And you need them to check you. Why do they need to check you? You can check yourself. When was the last time you looked behind your ear? How about on the sole of your foot? What about on your back, your lower back? There are places on your body you just can't see. And therefore, it is required, just like other things. You take your car in for an oil change. You got to go into your dermatologist and say, hey, can you check out my body and tell me if you see anything suspicious? Often what they do is they do a little map. They take pictures of you, right on their chart. And then when you come back next year and you're going, do you think that mole's gotten bigger? I don't know. Let's measure it. It's 11 millimeters. What was it this time last year? It was 5 millimeters. Wow, that's growing fast. You see, that's why you got to go see a professional so that they can help monitor you and make sure you don't end up missing or overlooking something. So the diagnosis, the actual diagnosis, oh my God, I have squamous cell. Oh my God, I have basal cell or melanoma for that matter, is done through a diagnostic biopsy, which is they take some of or all of the area that's concerning and they send it for a pathologist to look at. Now, often, depending on the size of the area you're concerned, they'll either take all of it, which is excision, like they'll get rid of the whole thing, or they'll take part of it in order to get a diagnosis and then come back and remove the rest of it if it is cancerous. So what are the ways that you can remove these things? If they're very early and we call them precancer, remember, cells don't just go from normal to abnormal. They go from normal to kind of abnormal to sort of abnormal to really abnormal to cancer. We call those precancerous cells. And if you notice them, you can then sometimes freeze them or fry them off or burn them or cause those cells to die off. But if you've gotten full-fledged cancer, then you need to address it. There are some types of skin cancers, and I'm not an expert, that can be treated topically with types of creams that sort of, if you will, fry off the cancer, but most require to be cut out. So you can either shave it, meaning to take the top of it off, or cut out the whole thing until you have what's called clean margins, which is where all the cancer cells have been removed and the only thing left are healthy cells. So diagnosis is through biopsy, okay? We're going to take a quick break. I'll come back. We'll talk about a little more about the treatments, and then we're going to talk about prevention. So we're going to talk about, like, how the hell do I avoid this from happening to me? Because you're absolutely right, Dr. Rahban. I spent all my summers at the beach. I'm about 55, Irish background. This doesn't sound good for me. What are my options? Let's take a quick break. We'll be right back with Plastic Surgery Uncensored. All right, welcome back to the second half of Plastic Surgery Uncensored, and we're talking all things skin cancer. So we talked about what causes it. We talked about how to diagnose it. Now let's talk about treatment. So treatment one is to burn it off or use a cream to burn it off. Those are usually very minor and early types of cancers. Treatment number two is to cut it out. So now it all depends. If it's a small area in a large area, you're good to go. What the hell does that mean? If you have a small little basal cell on your right thigh and it measures 6 millimeters and there's a ton of extra skin in that area, you cut it out, and how do you treat it? You close it. The dermatologist will just put some stitches and you'll have not the best scar, but it'll be done. What if you have a sizable area in a very expensive real estate area? What are you talking about? What if you have a 8 millimeters or 10 millimeters, which is a whole centimeter, on the tip of your nose? Shit, that's a problem. Now we've removed it. You got a big hole on your nose. We can't just close that. It just doesn't sew together. And that's a sub area within skin cancer. And that's what happened to Hugh Jackman in that he had it on his nose. Tom Arnold had it on his back. You got tons of extra real estate on your back. Lower lip, not so much. So you can see that some areas are plentiful, easy, some areas not so much. And it tends to be the face. So if you end up finding you have skin cancer on the face, you have to tread carefully. So there are dermatologists who specialize in just this. It's called Mohs surgeons. They're not really surgeons. Most of my friends who are dermatologists will get upset when I tell them that. They think they're surgeons. They're not really surgeons. Yes, they're cutting, but they're not like doing brain surgery, but yet still important. And what they do is they're dermatologists that remove the skin cancer on your eyelid or your nose, which is very, very limited space-wise, and remove it little by little by little and keep looking under the microscope. And they're looking for the transition as to right when they've removed all the skin cancer and all that's left is healthy tissue. The idea being is they want to remove all the skin cancer, but they don't want to remove any unnecessary tissue because you barely have enough. And so once that's done and they've removed the tissue, many times you're left with kind of a sizable defect. And that's where people like me come in. I'm a plastic surgeon, and then I'll come in to close the hole created by the Mohs surgeon as a result of removing your skin cancer in very expensive real estate like noses and eyelids and lips. That requires a tremendous amount of thought, skill, and ingenuity because you can't just whip it together like you can on a back. So if you find yourself in a situation whereby which you have skin cancer in those areas, you want to make sure your surgeon, you, and hopefully a plastic surgeon will have had this conversation. And I do this not too infrequently, working with other dermatologists regarding this with patients. If you find this part kind of fascinating, listen to our other episodes on this because we do a deeper dive into the sort of technical mumbo jumbo. So those are the treatment options. All right. Now, like most things, we want to not be there. I don't want to be even having this conversation, Dr. Rahban. I don't want a hole on my nose. I don't want a big old defect on my eyelid. I certainly don't want melanoma under my nail, which is crazy, but it happens. I want to just avoid all this altogether. And so here are the things that you need to consider. And more importantly, these are the things you need to do for your children. Because chances are, if you're listening and you're 50 plus, you're kind of already up Schitt's Creek in that whatever damage was created at the age of 7, 9, 14, 21, 29, 30 is already in you. You can't undo it. But you certainly can look out for it, make sure if you get cancer, you catch it early, and you damn well can make sure that the children in your life are protected and that they're not the ones at risk. So what are the things? Obviously, no-brainer. Avoid the sun. What does that mean? You mean I can't go to the beach with my kids? What about the pool? I love the outside. No, that's not what avoid the sun means. It means avoid getting burnt by the sun. So I am sure everyone has gone to the pool and now seen children wearing water clothes. Water clothes are SPF protecting t-shirts that protect the skin of a child and adults while they're in the pool, because that's one of the main culprits. You're in the pool having a blast and you're not hot and you're not burning and you're just having so much fun. Yet somehow by the end of the day, and definitely by the end of the vacation, you look like a lobster. Sun will get through the water and burn the shit out of you. So therefore, you need to be protected. So by far, the most powerful way to avoid the sun and yet be in the sun is to wear these types of garments that protect your skin while you're out. Of course, how do I protect my face? Wearing a cap or a hat. My wife wears the largest sombrero you've ever seen. She looks like she's like from Thailand in the farmlands. She despises sun. Now, in her instance, the truth be said, it's not so much she's concerned about skin cancer as much as she's vain. And yes, sun damage, aside from the cancers it causes, it fries your skin and makes you look old and wrinkly. And shit, for a lot of people, that's the reason to avoid the sun more than the skin cancer. At any rate, so the most powerful way is to just block the sun altogether. Umbrellas, hats, and these shirts or garments. The second, and of course the most tried and true, is SPF. Cover up. So let me tell you the tricks about SPF. I know people who say, I don't understand, I got burnt. And I put on SPF. And then I said, well, what time did you put the SPF on? Before I went out. Okay, what time was that? 8 a.m.? Yeah. And how many times did you reapply it? Reapply? What do you? Yeah, reapply. Yeah, you went kayaking, for God's sakes. You didn't reapply it? Oh, no, I didn't reapply it. Oh, okay. So then you're wondering why the hell you got burnt. Well, you got burnt because the thing only lasts about 3 hours. When you apply SPF on your body, it will be gone in 3 hours. You will sweat it off. It'll evaporate. It'll rub off. So you and your children must reapply every 3 hours or so, or it is useless. That is the number one issue. People think the number one issue is the number of SPF. After 30, you're pretty much the same. SPF 1000 is no better than SPF 45. It doesn't matter at that point. It matters that you reapply it, because when you get in the pool and go biking and you're doing whatever you're doing, it wears off. So SPF, you don't really need anything more than 30, 45 max, and reapply on a regular basis. Now, there are different kinds of SPF. You have zinc oxide, which is super, super protectant. It's like that, lifeguard stuff that they put. It's like white and cream and really thick. Not everybody wants that. Just make sure your SPF covers UVA and UVB, and make sure that it's broad coverage. And I got to be honest with you, most of today's SPFs are pretty goddamn good. The issue is not the SPF, more so that you're just not really using it correctly. You want to not be fooled. So what does that mean? I didn't even understand how I got burnt today. What do you mean? It was cloudy the whole day. Aha. So the most common place to get burnt is on a cloudy day, because again, you're misled. You think it's cloudy, it's shady, you're not really that hot, and yet you get burned. Correct. Sun goes right through the clouds and burns the shit out of you. So you cannot assume that if it's cloudy, it's not strong. The sun is strong despite the overcast and people often get burnt in that regard. It is a whole bunch of super deep burns that add up to create skin cancer later in your life. And it's really, really important you try to avoid those massive burns, especially in little kids who are out playing. So who's responsible for the kids? Parents. No kid who's 8 is going to run back and tell you, Mom, what's going on, Johnny? I think I need more SPF. It's been several hours. I mean, it's just not going to happen. So like everything else that you do for your children, you need to be a watchdog when it comes to sun protection, because as you now are hearing from all these celebrities in their later years, they're all getting skin cancer. I assure you, all of them got fried when they were younger. And back in those days, not only were people not aware of the importance of sunscreen and avoidance of sun, they were taking Mazola cooking oil, putting it on their body, taking reflectors and tinfoil, and super boosting the sun rays in order to get tan. Obviously, we don't do that anymore. Or better yet, we ought not do that anymore. So, at any rate, it's a very basic concept. It just requires repetition. And most importantly, as we enter the sun, and I guess May is Skin Cancer Awareness Month, and with all these new celebrities posting it, it's just about reminding yourself, hey, I got to make sure to be a little more diligent this summer and take care of the little ones. At any rate, hopefully that was a helpful little episode on skin cancer, prevention, diagnosis, and treatment. As always, I hope you enjoyed this segment. I have always 2 requests upon exit. Number 1, please share this show with people you love. I always say it. You never know who's going to go do something that they didn't tell you and you wish they had this information. So share it with them. And the other is, if you enjoy our show, you find it helpful, educational, entertaining, whatever, then go write something nice. We seldom write nice things. We always write how we're unhappy about things. We love your comments, especially when they're positive. All right, guys, as always, signing off on Plastic Surgery Uncensored, I'm your host, Dr. Rady Rahban.